I'm opening up the next slide on the HIV codes. When do you use the V code versus the O code? Would you code the patient as being active if they have a history of it? Tammy started this slide, and I had said, oh, I really like talking about this. Can I have this one? And she was gracious enough to do it. She started it, and I added some other stuff. So there is first not a history of HIV. If you're HIV positive or if you have AIDS, it's never going away. So a history is not a valid statement because history signifies that you used to have it, but you no longer have it or no longer getting active treatment for that. So if a patient tests positive for HIV, there's no cure. Okay, that would be like saying a person had a history of an amputation. Their leg didn't grow back. If you look at the guidelines, and this can be found in Section 2, Chapter C, 2A, it tells you to use 042 if the patient has HIV with an HIV-related condition. Now, everybody says, well, what's an HIV-related condition? Well, I'm going to show you some of those here in just a minute. Then it goes on to tell you in that same area, not A, but in D, you will notice that it says to use V08 when the physician uses the terms such as HIV positive. So HIV test positive might be the verbiage you would hear, or known HIV. Unless the term AIDS is used, then you would code 042. A lot of people get confused. HIV and AIDS are two separate things. Now, a person can be HIV positive and not have AIDS. A person could be diagnosed with AIDS, and because they have a condition that made them a related condition made them have AIDS, and they may not have even known they were HIV positive. So can a person come in and have AIDS? Yes. Can a person come in and be HIV positive? Yes. So HIV is a step, being HIV positive is a stepping stone to AIDS, but it's actually two separate conditions, and you don't want to miscode this. It is like giving somebody diabetes. You can't get that off their record, you know, and being HIV positive versus, you know, having AIDS changes everything. So the bottom line is, if the documentation only says HIV positive, or you might see terminology without an HIV-related condition, because if they have a related condition, it automatically turns HIV into AIDS, then V08 is the correct code that you're going to use here. But if it is HIV and there's a mention of an HIV-related condition, then you're going to use the code for AIDS. So what I did was I broke this down into ICD-10 as well, because we need to be aware of that, and many of you are getting ready to test in your proficiency assessment, and you're almost guaranteed to get a question on this because they want to make sure you understand the guidelines for this. You are being tested in the proficiency assessment on the guidelines. So Z21 is the code for HIV positive, right? The person does not have AIDS, they are HIV positive, right? Now what I did was I actually pulled this straight from, you know, that manual I told you that I liked earlier in the webinar. I have it online as well. And so I actually copied and pasted that. That's why you see this Carol Buck, excuse me, little sip of my Southern sweet tea. It's on page 1677 in the Carol Buck ICD-10 2015. Now, notice the excludes. In ICD-10, you have an excludes 1 and excludes 2, but it's telling you that this is excluding somebody that has AIDS, which is B20, and I'll show you that. And then don't get this confused as Z21 with being exposed to the HIV virus, which is Z20.6. Just because you've been exposed doesn't mean that you're HIV positive. And then it says a Z20.6 also is if you've had laboratory evidence of, no, excuse me, let's see, human immunodeficiency, yes, is if you have AIDS, it's B20. But if you've had a lab test and it's inconclusive, well, then you're not going to be a B20 or a Z21. You're going to be an R75. Okay, that means that they don't know. You know, you went and had a test, but something happened and they're not confirming that, or I guess you could say confirming or denying, but you're classified as an R75. They did a test and you don't know. So what turns this Z21 HIV positive into full-blown AIDS, which is B20? And I'll show you. Right there in the ICD manual for Carol Buck, and one of the reasons I really like this manual is it gives you all this extra information, and I don't think the other manuals do, but it tells you these 3 conditions that will turn HIV positive into AIDS. And one of these is this Kaposi sarcoma, where they get these black, more or less lesions, black spots on their skin. And it's it's described as large, confluent, hyperpigmented patch stage lesions with lymphedema. Okay, and again, you can see a picture of that on page 761 of the 2015 Carol Buck. Now, I pulled this one off the internet because I wasn't able to pull the picture from the ICD manual like I was able to pull these statements, because I'm sure that there wasn't a link there. Now, another thing that can do that is this little virus right here, and this is a PCP type of pneumonia. It's not the drug, this is the actual virus. And let me just pull down here real quick to tell you what that is, because I don't want to get it wrong. I always get it wrong. Come on. There it is. Pneumocystis, and I am going to call this Caroni, but I don't think that's how you say it, but that's how I'm going to say it, and pneumonia, PCP. That particular type of pneumonia turns HIV positive patients into AIDS. Then we have the Kaposi sarcoma, and then we have lymphoma, and which all of these are AIDS-related complexes, which is abbreviated ARC. And I'll show you this other one. There's that lymphoma, and the lymphoma is, you know, getting it runs the lymphatic system, and so you'll see swelling in the lymph areas, under the armpits, you know, behind the ear, wherever you have lymph nodes, which is really quite a few places in your body. So this is actually what that little pneumonia looks like. It gets in the lungs and starts shutting down the lungs. Any one of these 3 conditions, again, turns HIV positive people into AIDS. So you might expect a question like, you know, Mr. Smith comes in to get the results of his lab work. He's HIV positive, and he's had a persistent cough for the last 3 months. An x-ray's done, and he is diagnosed with this PCP. And again, they'll have your 4 choices, and you'll think, well, it's HIV positive, he's HIV positive, but no, he has an AIDS-related condition, which now makes him a B20, that he has AIDS. And this is also in your ICD-10 manual if you get the Carol Buck one from Elsevier. It says acquired immune deficiency syndrome, which that's what AIDS stands for, is caused by an HIV, human immunodeficiency virus. Okay, so again, you can be HIV positive and not have AIDS. HIV affects certain white blood cells, and this tells you what type of cells, and it destroys the ability of the cells to fight infection. It's an autoimmune disorder or an immunodeficiency disorder, and it makes the patient susceptible to all kinds of infections. And the main ones, these three, are pretty common with people who have AIDS. Right? And then last, just giving you more information about AIDS itself is, and it being B20, this includes, you might see terminology like this, acquired immune deficiency syndrome, which is AIDS is the acronym, AIDS-related complex, ARC. If you see that, that means that they have full-blown AIDS. HIV infection symptomatic. So you have symptomatics means they have symptoms, okay, of AIDS, meaning one of these diseases. Asymptomatic, A stands for without, and so if they're asymptomatic, they're HIV positive, but they have no symptoms of AIDS. Also, if the person has the HIV, and there's a little note about pregnancy, and then it says additional codes to identify all manifestations of the HIV infection. So if that particular scenario I told you about earlier that might be a test question, then you're going to code the PCP, that particular type of pneumonia. You're going to have the B20, and then you'll have the PCP code. Okay. Now, this excludes one is telling you if it's asymptomatic, don't code Z2, or you're going to code Z21, not B20. If they've just had exposure to AIDS or the HIV virus, Z20.6 is what you code. And if they've had an inconclusive lab work done, that's R75. So the manual tells you and reminds you, heads up, pay attention to these. So just to recap real quick, it's very important that you don't give somebody a diagnosis that they don't have. So don't give them HIV if their lab work's inconclusive. Don't give them AIDS if they're only HIV positive. Okay, so that's a look in the ICD-9 and the ICD-10. And again, that will be on your proficiency exam. It's on a question regarding HIV and AIDS is almost always on the testing because the guidelines are so important. They want to confirm that you know those.
Do you need more medical certification training? Go to www.cco.us. And don't forget to subscribe to our YouTube channel for updates.